Welcome to the New Dentist Study Club podcast. My name is Dr. Sanj Mohanta. We're going to learn about clinical management, practice management, and the emotional management of dentistry. Let's learn how to be happier in dentistry. Let's go. Thank you to our sponsors, Altum Dental Lab Group and RDT Dental Lab in Toronto. Hello, my friends. So grateful to you all for joining us again. We have a fantastic podcast because we're doing two things. We're introducing the New Dentist Study Club London with the founder, Mostafa. And we're also answering your questions, common questions that new dentists have where, they're struggling. So first of all, welcome to the pod.
Hi, thanks for having me. I'm really excited about joining you guys today.
We're really excited about New Dentist Study Club London. So first tell us about yourself and then tell us about your new study club.
Sure. My name is Hassan Mostafa. I'm born and raised here, London, Ontario. Graduated dental school 25 years ago. Went to Detroit Mercy for dental school and started practicing in London right out of school. I had a great mentor for the first 5 years of my career until I bought one of his smaller practices. And yeah, I've been practicing now. We've grown our practice. I now work in a large group practice, 10 ops, 3 dentists, couple specialists. Thankfully, I've been able to transition my practice where I mostly do surgery and implants. And I also help out on Fridays at the dental school at Schulich in the oral surgery department. So dentistry it's been a great career for me.
That's incredible that you're helping students at Western Schulich Dentistry. So is that what inspired you to start the New Dentist Study Club London?
Absolutely. And so
Yeah.
I've been mentoring students who want to get into dental school, students who are in dental school, and then some kind of recent grads. And so also through working at the dental school, I'm kind of hearing the same questions, the same concerns, the same issues they're all dealing with, and they've always asked me to kind of formalize it. And when I discovered your study club, I was like, well, I'm not going to reinvent the wheel. Let's call up Dr. Sanj and see if we can partner up and let London not just be the little sister, but let's Schulich needs its own study club too. So
Yeah, it's true. I'm glad our family is growing. So thanks for starting that up. And it's going to start in January. So we're very excited about that.
yep, no, we're ready to go in January. I've already got a first few speakers ready to go, and we're kind of following your format that seems to be working really well, and we're excited to start.
Thank you. So you can stay tuned to the end of this presentation on information on how to join New Dentist Study Club London. But first, let's start, answering some of the questions that our listeners have asked and what New Dentist asked me recently at the Ontario Dental Association's New Dentist Symposium. So the first question that was asked was, a new dentist has said that she gets really nervous, even just doing simple procedures like simple extractions, because she's worried what's going to happen afterwards. What if my patient's bleeding at home? What if there's a medical emergency? How would you help that new dentist?
So first is you need to kind of get your skills up. Like you got to make sure that these cases that you're taking on are in your comfort zone, in your world of competence. So, I mean, if you're doing a relatively simple or, minor surgical extraction, you were well trained at Schulich or Toronto to manage those cases. And, complications are going to happen. If you think they're not going to happen, then, you're going to learn pretty quickly. And you gotta manage them. And so patient comes in with bleeding or calls you. You should have 2 or 3 nice tips to maybe give them over the phone. I'm always telling patients to, sit down, don't move, put a piece of gauze, pressure for 30 minutes, and then if it's still bleeding, call me back. Or you bring the patient back in and you maybe got some gel foam, you got some Surgicel. There are ways to manage all of these complications. Now, if you don't feel competent doing that, well, then you need to take some courses, or you need to find a mentor, or someone to back you up. Or even, you need to have a good relationship with an oral surgeon where you're going to call him or her up on the phone and say, hey, how do I deal with this? What can I do for this patient? Or if it's bad, they should be able to help you out, maybe even see the patient for you. So, don't be afraid to do things that are inside your comfort zone. The only way you're going to learn is by pushing your envelope, but pushing in a um, in manageable way that you're not going to go too far out that comfort zone.
Oh, yeah, all great answers. When I first heard this question, I was like, what do you mean? She's scared doing a simple extraction? Like, what can go wrong? But then recently I got my oral sedation license. So when I started doing oral sedation, I was getting really scared because I thought, what if I miscalculate and I give the child too much midazolam? So I realized that I was really anxious and I had the flumazenol backup just in case. And my heart rate was going up. And then it was actually a mom and a child who came in and they were so nervous about that oral sedation appointment that they're like, we're really nervous. Like, we think that she might die. And then I was like, oh, don't worry, she's not going to die. And then I went, yeah, that's right. No one's going to die here. So why am I nervous? And I'm making them more nervous because I'm anxious. So then I was just like, you know what? I've done the course. I've done this before. I have the flumazenol backup. If something goes wrong, I can take care of it. And like you said, if something really goes wrong and I need expert help, I have specialists that I can call upon. So it was just realizing that, okay, I got the license because I passed all the requirements. I know what I'm doing.
A lot of this comes from experience too. I mean, the
Yes.
first time you sedate someone, you're going to be super
Yes.
nervous. The first time you
Yes.
do an implant, you're going to be super nervous.
Yeah.
I mean, all of that, and that's a good nervous energy. And all that
Yeah.
starts to go when you're on your fourth and fifth and
Yes.
10th
Yeah,
and
that's true.
50th. And then you start seeing complications.
Yeah.
And then the first few are like, oh my God, now what do I do? But
Mm.
then, you get to a level of experience where you're able to manage all of those things and you know how to do it and you're confident in your abilities and you're confident about what the next steps are. Then once in a while, you're going to get stumped on something. But then you're going to make a call or you're going to, do a little Googling or you're going to look up a journal and look those up and get the answer. And then guess what? Now you've just become that much better of a clinician. So, I mean, we only learn by making mistakes and by doing our homework and getting better at it through experience.
Yes. Very good. Yeah. More experience. You just need more minutes on the field and you'll see that anxiety drop.
Yeah.
And also, like a couple of people said they're worried about their patients having medical emergencies. And that's why we do annual CPR training. That's why we review medical emergencies, with our whole team. And, here's another story. I was on a plane and there was a 4-month-old who stopped breathing. So then right away I knew what to do. I did an infant CPR and the baby started breathing.
Wow.
So, and I was surprised. I was like, wow, like I've never done CPR on anyone. And here I am on a plane and I was able to save this baby. So, like all that training, it does stick with you and you will know exactly what to do if something goes wrong.
Oh, absolutely. I mean, I had a similar story just a few months
Mhm.
ago in my backyard where my best friend, he was eating a carrot and it went down and he looked at me and he's like, and he
Oh, he's choking. Yeah, he's
so,
pointing to his throat and saying he's choking.
yeah.
Yeah.
So I turned him around. We did the thrusts, and luckily, it worked out. But I mean, and these are things that you learn for dental purposes, but they have so many
Yes.
life applications
Yeah,
too.
it's true.
But
Yeah.
for
So
the medical emergencies, those, I mean, even though I've been doing this for 25 years, every 2, 3 years, I still do the medical emergencies course at Schulich with Dr. Ankans, I believe, think
yes, that's right. Peter
does it. I
Nicanza.
mean,
Yes.
do it every 2, 3 years. It's a refresh. I mean, because you don't do the stuff very often, you tend to forget. And but it's good to have the cheat sheets and the little plaques and the cards and all that. But it's always good to kind of go right back to the basics and redo all that stuff over and over again because you never know one time it's going to be serious and one time it's going to happen. And are you going to sink or swim? So.
Yes. And for those procedures that you're not too comfortable with, that you haven't had too much experience with, review the steps, watch YouTube videos, go through your notes again, visualize the procedure, practice on a mannequin, practice on an extracted tooth, like doing the root canal. So all those things will help you with your confidence.
But you also have to
Mm.
remember too, I mean, what's the most common dental emergency? It's syncope. It's just a patient
Yes.
getting
Mhm.
anxious or something and fainting. The real heavy duty stuff that we all train for that, I mean, it's so, so rare when those things happen. But,
Yes.
you kind of brush up on the top 5 things that are going to happen. And I mean, I'll probably experience syncope in a patient maybe twice a year. But what happened? We did have a patient last year that had a full MI in our office. She was
Wow.
in a hygiene chair. It wasn't even a surgical procedure or anything.
That's
Um,
scary.
and while I remember I worried that, oh my God, she might blame us for
Hmm.
a heart attack. No, she came back when she recovered. And she's like, you guys saved my life. Because if I had this heart attack at home, I would have
Hmm.
died. No one would have helped me. No one would have picked me up. And
Yes.
she appreciated the fact that it was here. We pulled out the AED and the whole thing. The ambulance came. So, I mean, it was a positive in the end, although it's never
Yes.
good to have an ambulance in front of your office,
Yes.
but ended up being kind of a great story.
Yeah, I'm so glad that she's okay.
Hmm.
Mhm.
So,
And for all of the dentists out there listening, you're going to be okay too.
mhm.
Mhm.
It's yeah, there's like something's always going to happen. You always got to wake up saying, you know, I'm going to go do the best I can, and
Yes.
yeah, you'll have a good day, and things shit's going to happen, but it's
Yeah.
just a matter of how you manage it and how you you know, rise to the occasion, and you have the ability to do so.
Yes. So here's another question. It has to do with a bit of the perfectionism that we all have, which is probably why we went into dentistry, where they're like, we don't like the fact that, the restoration we did, the crown we did, it wasn't perfect.
Hmm.
So, and you don't have the time, even if you did have all the time, even if you could take out the tooth and work on it and put it back in, it's not always going to be perfect. So how do you deal with it not being up to your standards?
It's not always going to be perfect. And if you're going
Yes.
to use all of the wonderful Instagram shots and posts that all of our mentors and all the experts out there are posting, and if you're going to set that as your standard of what every restoration or every implant is going to look like, you're setting yourself up for failure. We always should strive to do the very best we can and to make it as good as our final product as we can. But what is it? Perfection is the enemy of good.
Yes.
I think that line goes. You do the best you can. You do as much CE as you can. You practice as much as you
Hmm.
can. But you have to know that, you know, clinical situations are going to make things challenging for you.
Hmm.
Saliva, patients gagging. There's so many variables and factors where a patient can only open like that much, and you got to do a
Yes.
endo on a 7. You know, do you do it or do you refer that off? It's but you have to remember the endodontist has to deal with a patient that can only open a few centimeters.
Yeah.
So no, perfection is the enemy of good or very good or clinically acceptable. But yeah, I mean, strive for the best you can. You make that contact as perfect as you can. There are certain clinical aspects that are non-negotiable uh,
Hmm.
in terms of your work, but there's so much that's also. I mean, I always tell young dentists, you can stress over the cusp anatomy that you're going to create in a restoration, but a patient's never going to judge you on that.
Yes.
In my opinion, a patient's going to judge you on only 2 or 3 things. Number one, your personality. Do they like you? Did you
Hmm.
connect with them? Did they leave saying, you know what, I like him or her, you know, I want them
Yeah.
to be the dentist. Two, your anesthetic technique and whether the appointment was painless and whether
Hmm.
you cared enough to make sure it was painless, or if it was sensitive, did you stop and really address it and make them comfortable? Beyond that, patients are really are not going to be able to judge the very fine technical nuances and skill of a very good restoration to a perfect quote unquote restoration.
Hmm.
Those are the things I was trying to, you know, advise young dentists to kind of strive for is to, you know, build a relationship with your patient and focus on making sure that appointment's painless. And then you'll likely end up with a patient for the rest of their life.
Yeah. Focus on the patient, not perfection.
Hmm.
And also, if you do something like leave an open contact, you couldn't isolate the area well, then you can tell the patient, hey, like you deserve better. But, I'd like you to come back another day. We're gonna do a better job with this filling. It's fine for now. Make sure you floss it.
Hmm.
And at first you might think, oh, the patient's gonna be upset. They have to come back. Then they realize, like, wow, this dentist really cares about me and wants me to have the best in my mouth. So they'll understand and they always come back.
Hmm. So this is where communication becomes huge and key.
Yes.
If you communicate with, like, I
Mhm.
remember there was someone who asked me about, well, I'm worried about a college complaint about something.
Mhm.
The college is not going to come down hard on you if you didn't have a good restoration or if you broke a file or something. A
Yes.
college is going to come down hard on you if you didn't tell the patient or
Yes.
if you didn't communicate the possible risks or the possible situation or properly inform them of a complication.
Mhm.
or how to manage it or how you're going to manage it. If
Hmm.
you try to say, I don't know, I'm really shy or embarrassed to kind of tell them about it and just hoping they don't notice, those are the ones that are going to come back and bite you in the ass. And then the
Yes.
will come down on you. But, again, shit happens in dentistry. And if you communicate it or if you've kind of told your patient all about it and you've been open and transparent and you documented it, for God's sakes, you got to document all these things,
Yes.
then yeah, you've got a really solid leg to stand on. Because
Hmm.
even the toughest college investigator is going to understand that stuff happens, complications happen. There are the material complications, and then there's the super rare ones. The material ones you need to inform a patient about. But yeah, you're not going to get dinged just for having something bad happen.
Yes. Really good advice. I remember when I was a new dentist, I was afraid to tell my patients beforehand that, the decay is really deep. They might need a root canal afterwards. They might have some sensitivity. And then they would oftentimes come back and go, oh, that tooth is really sensitive. And then I'd have to say, well, actually, it was really deep. And you might need, you might even need a root canal. And then instead of, you know, being thankful that, I'm trying to help them, they're like, well, why didn't you tell me that before? I wouldn't even done the filling if I knew I would have sensitivity. And did you drill too far? And that's what they're thinking. So they'd rather have like some insight, some foresight instead of some oversight.
So I remember hearing once, if you're explaining something after it happened, then
Yes.
you could be interpreted that you messed up. But if
Yes.
you kind of warn them in advance and you almost predicted it, then
Yes.
you end up looking really smart and you were the hero for having, yeah, you said that was going to happen and you knew it happened. And I
Yeah.
always found that, but the days of replacing amalgams, large amalgams, and putting cores in,
Hmm.
and then a patient that was asymptomatic gets a new restoration,
Yes.
hurts. Now they need an endo. Now they need a crown. That just was a situation I always felt terrible about. And it just,
Hmm.
especially even happened to my mom. She's like,
Yeah.
it's fine until you put your fingers into it.
Exactly.
And so, but now, yeah, you're telling, so whenever I'm seeing either deep caries or I'm seeing, a really large restoration, I'm telling them, these are the possible situations that might happen. We might need a root canal. We might find a crack. We might, all these things in advance. And when it happens, then you're like, they were aware, they told you. And sometimes they're even a lot more understanding than if you're just trying to explain it after that, it was deep and this and that. And now you're just trying to cover your ass.
Yeah, it's true. And the patients will actually come back and say, hey, you're right. That
Yeah,
tooth did become sensitive. And then
So,
it's like, hey, I'm going to take care of you.
so it's funny. One of the funniest things that I ask a patient is like, okay, well, the only thing left to do now is to do a root canal. Does this sensitivity hurt bad enough that you want a root canal? And they're like, yeah,
Yes.
it's not that bad. No, no, I'm okay. I'm all right.
Yeah.
They're happy to kind of now if a patient calls and says, I want the root canal, then yeah, then
Yeah, it's true.
you got to move on to the next step.
Oh, yeah, very good advice as well. Now, how about college complaints? Because some dentists said they're so scared of doing dentistry because they're worried the patient's going to complain. So, have you ever had a college complaint, patient complaint, and how did you deal with it?
So yes, I've had a few. I'm actually dealing currently with one right now, and they suck. They're stressful. They're annoying. But it comes down to, did you document? Did you do everything you were supposed to do? And then there's maybe a humbling part of that where you're like, you know what? No, I did. Maybe I did miss the mark a little bit, or maybe I should have done something differently. And there are varying severities of college complaints and various things the college will do to help remedy the situation. Um, I don't know of anybody who hasn't had a college complaint.
Hmm.
Out of all my colleagues, it's disheartening when you get a young dentist. I know a young dentist who graduated only 6, 7 months ago, and he's already dealing with a college complaint.
So stressful.
And that's stressful and that's tough.
Hmm.
But you know what? You got to go back to your notes and you got to make sure you document it. A lot of times I get asked, do I need a lawyer to do this for me? And I'm going to say it depends on the severity of the complaint.
Hmm.
You need to hire someone to help you with it. Again, there's going to be the frivolous complaints that are out there also. And so take a deep breath. You're going to have those days when you leave the office, you're like, man, I'm the shittiest dentist in the world.
Yeah.
And after 25 years, I still have, those days. And you're going to have the days where you leave, you're like, you feel like you're a rock star. You're on cover,
Yeah, it's true.
awesome case. That veneer case went in great. Patient loves me. They get
Yes.
flowers and gifts from patients. You got to take the good with the bad. Don't get too high when they're good days, and don't get too low when you have a bad day. But yeah, no, it's just part of but it's part of our profession. Patients need to have a recourse. And trust me, there are situations out there where a college complaint is very warranted. There are mistakes made out there for good intentions and even sometimes maybe not so good intentions. But so the college does have a very important role to play. But yeah, you need to do your best to kind of navigate through it, follow all the steps, get the advice when needed, and it will pass. It will pass.
Yeah,
And,
no, it's true. And
and
you'll learn from
learn
it.
from it. You'll learn
You'll
from it. You're
be
gonna move
better at
on.
record keeping. You'll be better at case selection. You'll be
Yep.
better at patient communication
Hmm.
because, there has been like reviews of complaints to see like what the number one cause is, how it could have been prevented. And number one was patient communication. The patient felt that they weren't being heard, understood, that,
Hmm.
their needs weren't being met. So then
And
they
I don't know
had,
if you missed it also, but I miss the days when the college used to send out all the summary of all of the
yes.
discipline. They don't mail that out anymore. I think you
No,
have to
you have
look
to go
for it online,
online.
and no one's going to go online to look. I mean, but because I remember, I would very actively look and read through, not for the gossip purpose of it, but for the okay, like what's getting done here that
Yeah.
gosh, maybe I'm doing something,
Yes,
and to make you learn from other people's mistakes too,
exactly.
what people are being brought up for, and so that you're like, oh, you know what, endo, let me brush up on this, or let me go back and look at my consent forms and say, do I need to make
Mhm.
any changes or anything? So yeah, I miss those days when the college would mail that
Yeah,
out.
it's true.
And
And
so
oftentimes, before it becomes a college complaint, it starts off as a patient complaint,
mhm.
right in the office. And if you do your best to manage it, it won't escalate to a college complaint. So that might be referring the patient out, reimbursing the patient, redoing things, doing things for free. It's having that
I've
phone call
I've
with them and saying, like, what's the problem? I apologize. How can I help you? Mm,
I've never had an issue with sitting a patient down and saying, how can we rectify this for you? And
good,
I've never been shy to just write a check. Uh,
good.
and so, it's and a lot of times you're going to want to stand on your principles, and you're like, well,
Hmm.
and even you don't always have to be right. Um,
Hmm.
and sometimes just swallow it, write the check, and it is going to save you the headache and the stress, and potentially a bigger check down the road.
Yes, I agree.
And so, and there's been times where I haven't followed my own advice, but it's I'm not shy about doing that. And I think it's better. And even personally myself, I mean, we're advised never to really offer a guarantee or a
Hmm.
warranty on certain things. I tell my patients, if this doesn't work out, I'm just going to cut you a check back, and with my
Good.
apologies. And that way a patient feels reassured that okay, if it doesn't work out, I'm not out of my pocket at all for anything.
Mm.
Um, they appreciate that. So
Oh, very good. Yeah.
mm.
Thank you. And another question is, how much money should an associate typically make in a day?
Yeah. So this is the question all the time when I get to when I'm at the dental school in the fourth years, or
Okay.
they ask me, how do I find a good associateship and a good mentor, and how much money am I going to make? And it's funny because it was the very same questions I was asking my boss. And it's going to vary. And it's going to vary. Now, I have two associates who work for me. One's Dr. Laura's been with me for 4 or 5 years now, and Dr. Will's been with me a year and a half. Um, I'll say that after 6 months to a year, my associates were, I want to say, taking home about 15 to 20 grand a month after. And so again, were they super busy? Were they doing super high-end procedures? No, they were doing good old-fashioned drill fill, extractions, partials, things like that. I think what the number is 2 to 3 grand per day of
Hmm.
production is a pretty reasonable number for a relatively new dentist.
Hmm.
Now, you have those who are going up to really remote locations where you're getting tons of experience, and those are great experiences also. And you have the potential of making significantly more. I never really focused on what the production number was. it's if you have a relatively full schedule and you're taking care of your patients, the numbers just kind of all fill in on their own. Now, I understand there are loans to pay, and you're starting your life,
Hmm.
and you want to eventually buy a practice and a car and a house and get a spouse. It's a lot. It's funny. I had a couple students a couple weeks ago. She was just like, "Oh, the stress of dental school is just killing me," thinking that once she graduated dental school, all of the stress in her life was going to go away. And I'm like, no, you need to learn how to manage these stresses. And while yes, dental school is stressful, it's going to amplify itself when you get into the real world and an associate. Then you're going to be a practice owner, and there's stresses there. It doesn't really go away. You just have to learn how to manage it and deal with stress. And but yeah, sorry, I veered off. But in terms of production, if a new grad came to my office, started working, I would hope that within 3 to 6 months they're producing, 3 grand per day, which yeah, gives them a pretty decent income, and you're only going to grow from there.
You mentioned managing stress. How
Yeah.
do you manage stress, Has?
I manage stress in a unique way in that I look at the problem that's in front of me
Hmm.
and I say to myself, is this problem still going to be a stressful, relevant issue 1 year from now in my life? And if the answer is no, then I go to sleep and I sleep just fine.
Yeah.
And so there are the individual stresses of the day-to-day things that kind of come around. But I just kind of, deal with them, manage them as best I can, move on. And I know that, a year from now, I mean, God forbid, I stress that would be really worth stressing over is a severe illness of a family member of mine.
Hmm.
That's something that, yeah, that would be very, very difficult. And that's something that's going to just consume me. But, someone in my office, hands the resignation. And while that's really going to be a huge, huge pain for the next, four
Yeah.
to 6 weeks, you know what, a year from now, I won't even remember that problem. And so
Yeah.
I'm not going to let that really take me down or cause me to lose any sleep over it. I'm just going to, swallow it, deal with it, manage it the best I can, and then move on. That's how I deal with stress.
That's good. You put things in perspective.
Exactly.
Is this going to be a problem that I'm going to think about a week from now, six
Hmm.
months from now, a year from now? And all of a sudden you're like, in 6 weeks, this is going to be resolved. I'm going to find a new associate. So,
Exactly. Yes. But no, and stress is going to be there. And even, I'm at the age now where I'm starting to sniff retirement and all that. And I'm like, oh, the stress is going to be gone. But I know there's going to be other stuff down the road
it's
that's
true.
going to come around. And even if I'm on a beach somewhere, someone's going to text me or call me with some problem or issue. And, we'll just deal with it. So,
When you mentioned mentorship, a lot
hmm.
of dentists are struggling finding mentorship. They expect to get it from the principal dentist, but the principal is busy. Other dentists are busy. How do you get that mentorship?
So I was really fortunate. I graduated dental school knowing I was not fully ready. And I
Mm,
graduated wanting an associateship where there was a senior doctor there. And I landed a great job with my mentor, Dr. Merrick, and God rest his soul, where he was there with me and he had great surgical skills. And he was a safety net for me that I could always push my envelope of competence knowing that, what, if I got stuck on a route or something, I could, go down the hall and tap his shoulder and he'll come and show me, help me, bail me out. And you need that. That's the only way you're really going to grow and expand and get better is by kind of
mm.
pushing that envelope, but having someone to kind of back you up. And that's what I've done with my associates. And now, they're doing very well surgically and up.
Good.
But how do you find that? So
Mhm.
when I tell fourth year students or young dentists when you're interviewing for a position, they're not just interviewing you, you need to interview them. And be clear about what you need, what you expect, and that, a lot of senior doctors who own multiple practices, they hire a new grad, they put them in an office where they're on their own. And that's tough. They'll say, well, we can go over cases or that's not really mentorship. I think you need to have someone else in the office there at least 1 or 2 days a week. So you're going to book those tougher cases where you think you need some backup
Mm.
at a time when another doctor's there. And that to me really is true mentorship. And you need to find those kind of associateships, and they're out there. But to just work in a group practice where you're by yourself in a location, I think is really challenging. So.
Oh, good advice. You're interviewing them. You should have, just like when you buy a house, you have a list of these are the things
Mhm.
I want. I
Yeah.
want a fence because I have a dog. Like you have to, you have to have a list of what you want your a perfect associateship to look like.
Yeah, and also the things that you want to learn. And so,
Mhm.
for example, let's say you want to get into CAD CAM. Well, you probably don't have 200 grand to buy the new CRX system. And so look for an office that has that. So you get to use it for free. And you can learn on it for free and take the training and not have to invest all of the capital into to kind of getting that kind of stuff. And then when you go buy your own practice, you've used it, you know how it works, you know you can make it work. Then there's not a lot of stress about, making that capital investment. Same with implants, same with, I mean, there's so many aspects of dentistry where there's some significant capital things you need to get into before you can start and do your first implant. And if you can find a place where they have that, then that's the place you really want to go.
So thanks, Hess. You've been a fantastic mentor to so many people, the students at Schulich, your associates, and now all of us. So
Thank you.
tell us, yeah, you're welcome. Tell us about the New Dentist Study Club London. How can people join?
So we have this new study club. It's not officially associated with Schulich. Really, I just saw what you've done, and a lot
Mhm.
of the new grads and dental students are like, we need that in London. So at their request, I've kind of taken it upon myself and took your playbook, and we're going to open it up here in London. So I mean, if they wanted, we're kind of gearing it to a new dentist in the first 5 years of
Mhm.
practice. And we're keeping the topics really relevant to what they want. So I'm asking them, what do you guys want to learn about? What do you want the speakers to talk about? It's not just what we want to talk about. And so they're giving me all the feedback, and we're gearing the seminars to what they want to hear. And yeah, we're starting in January, and we're looking for between 30 and 40. We've already got about 22 people signed up.
Wow.
So super excited about that. And they're going to meet new people and meet new specialists and new experienced dentists. They can find mentors. I'm bringing mentors along also, so that if they want to, go over cases with some senior doctors or specialists, they'll have that. So if anybody wants to join, so we get on Instagram, it's New Dentist Study Club London, I believe it is. Or you can find me, Has the Dentist, on Instagram also, or you can reach out to me at Aria Dental Center here in London. It's all different ways you can get a hold of me. But yeah, we'd love to have anybody who kind of wants to come learn and kind of be part of the club.
So excited for the club. Thank you for leading it.
And
I
you
think we need
promised
to
to come
change.
into our first course, our first
Yes,
date. Yes, gotta
lovely.
come.
I will be there. I'm looking
Thank
forward
you.
to it. You should
That's
change
great.
your Instagram handle to Has the Mentor
No, no, it's
because I'm
fine.
helping so
Dentistry
many people.
is great,
Okay.
and any way we can, because the dentistry's been such a great career. It's
It
given me
is.
much, and I really enjoy being at the dental school on Fridays, and they keep me young, and it's been great interacting with them and answering all their questions, because the same questions I had 25 years ago,
Yeah, isn't
and
it great to give
they
back?
get so lost, and they really just want to kind of, what's the first few years of my career going to look like? Help me paint that picture, and
Yes.
sometimes I'm happy to help out with that.
Oh, we're so happy that you're on this podcast. Thank you so much,
Thank
Hess.
you so much for your time. It was a lot of fun.
Yeah, it was. And thank you to the audience for listening. Until
Thank
next
you.
time, you're welcome. Bye.
Have a great day. Take care.
This podcast is sponsored by RDT Dental Laboratory, your full service dental lab in Toronto. RDT Dental Lab will help you grow your practice through education, predictable restorations, and high attention to your clinical needs and patient experience. Check them out at rdtdentallab.com. Thank you for listening to the New Dentist Study Club podcast. Listen to us on Spotify, watch us on YouTube, share and subscribe, and follow us on Instagram at New Dentist Study Club.